The opinions expressed on this program represent the viewpoints of individual authors or contributors and do not necessarily reflect those of Troy University.
Hello and welcome to EconVersations. I'm your host, Dr. Dan Sutter of the Johnson Center for Political Economy at Troy University. Occupational licensing involves having to get a permission slip from the government to be able to work in many types of jobs, and is becoming increasingly prevalent and burdensome in Alabama. But exactly how burdensome? Joining me on EconVersations today to discuss some of his new calculations that he's made for Alabama in a new study is a colleague of mine from the Johnson Center, the Associate Director of the Johnson Center, Dr. Dan Smith. Welcome back to the show, Dan.
Thank you, Dan. It's great to be here again.
So let's get started. This work that we're going to be talking about today is contained in a new study that the Alabama Policy Institute put out in conjunction with the Johnson Center, right?
Yeah, so I did it with a couple colleagues, Courtney Michaluk, who is a policy analyst in the Johnson Center here at Troy University. We had Alex Canode, who is currently a master's fellow at George Mason University and affiliated scholar with the Mercatus Center there. And we also had David Hall, who is a graduate of the Troy University's Master's in Econ program. So a very strong mix of co-authors. We got together over the good part of the summer and crunched and gathered a lot of data and spent a lot of time putting this pretty lengthy report together with a lot of calculations that we think are going to be exciting for reforming occupational licensing in Alabama, because it does represent such a burden, especially on low-income individuals.
Now, there's a lot to the whole issue of occupational licensing that this study talks about, but we're going to particularly focus in on one element here, which I think is really innovative or a new addition to the discussion here in Alabama with some of these cost estimates that you've come up with. But before we get into that, let's just take a few minutes to remind people, like, what exactly do we mean when we talk about occupational licensing?
Yeah, so by occupational licensing, we mean literally a government permission slip, as you said, that someone needs to get in order to be occupied and practice in that profession within Alabama. So they have to submit an application and go through this approval process in order to be able to practice as a lawyer or a dentist or a florist or whatever occupation happens to be licensed.
And how prevalent is occupational licensing here in Alabama? How many different occupations require such a permission slip?
So we located over 150 different occupations that were licensed in Alabama. Now this is a conservative number because there are some, like home builders, that has carpenters, electricians, mason workers, all sort of concrete workers. There's a lot of different subcategories under some of these licensed occupations, but to be conservative, about 150 licensed occupations in Alabama.
All right, so let's talk about a little bit about what's involved if you get if you're going to get a license. So if you want to be a barber in Alabama or a plumber or run in one of these 150 different fields, what do you have to do? And so let's get into this.
Yeah, so anyone in these 150 licensed occupations, which represent about 23% of the entire Alabama workforce, you have to, first of all, you have to download from the board the instructions for what you have to do to meet the requirements just to submit an application. So you have to make sure you have the education, experience, internship, whatever the requirements are. You have to have obtain those ahead of time. Usually you have to have an exam that you have to take. You also have to pay some fees associated with the exam, studied in the application material, and as well as renewal cost every year that you have to end up having to pay as well.
So what you went and did is tried to estimate as best as you could, given that there's we'll get into some of the details, but you tried to estimate some of these costs. So let's start with the first license. So you're ready to go, you're ready to fill out the paperwork and submit everything. What's all involved with this upfront with your first getting licensed for the very first time?
So the main cost is just the opportunity cost of submitting the paperwork across 23% of Alabama's workforce if they each take an hour to do this every year. Initial licensing costs are probably even more than an hour, but to be conservative, we just said an hour. Then you have to pay that application fee. So sometimes they even had an application fee and a licensing fee, but there's usually this upfront cost that you have to pay just to submit the application to be approved to practice in that profession. Across the board, we saw a wide range of different costs. The most common, as you can see from this graphic, is $200 to $299 for a license, but there were some occupations in Alabama that charged over $1,000 in application costs.
And a number of others, they're over 500 as well. So that's a pretty fair amount of money.
Yeah, in total, it adds up to over 45 million or $122 million for everyone in Alabama to pay these initial licensing costs.
So of the 23% of our workforce that's currently licensed, they would have, if they all had gotten licensed with the current fees in place, they would have had to spend that much money, right?
Yes. So looking at all those workers currently licensed at 23% of Alabama's workforce, that adds up to a shocking $122 million.
And that's not the end of it, because I know my wife is a lawyer, and every year you have to also pay bar dues, or you have to renew your license every year as well, right? And so you have to. This is your first check you pay send in isn't your last, right?
Absolutely. You have to. Sometimes it is every 2 years, but then in which case we just annualized it for every year. But we did not find any occupation that did not require at least renewing every 2 years.
And how much are these amounts here?
So you see, once again, you see a wide range. You see a lot more with renewal costs with zero cost, but you do see a substantial number of occupations, especially in the $0 to $199. So every year, that's what they end up having to pay just to keep that license open, so that they can continue to practice.
And there are also taxes or other types of fees that are closely involved in here with licensing as well, right?
Yeah, there's taxes wrapped up in there. There are that fall on specific occupations in Alabama. There's also other associated. Sometimes there's we'll get to this, but renewal education costs. You also see like site inspection costs for some occupations, and things like that. So they are pretty substantial costs that end up eating into the pocketbooks of working Alabamians.
And I think I recall you tried to make some estimate of the total amount that our licensed professionals would have paid both upfront and then these annual accounts over the course of their entire careers. Do you remember how much that was?
Yes, let me. I did bring a little cheat sheet because we're dealing with a lot of numbers here. But we estimated that it was about $45 million every year for these 23% of the Alabama workforce that is licensed to pay in these fees. So and if you add in an opportunity cost for the time it takes, an estimated time it takes to fill out the paperwork. So I just put it at 1 hour to be conservative. That raises it up to over $50 million.
Right. And that's something they'd have to pay every year. And so I mean, this is going to really add up over the span of, say, a 30 or 40 year career. You pay that initial fee, and then this, whether it be $50 or $100 or $200 every single year after that as well, right?
Absolutely. And if you start to think about the opportunity cost of money, and then, okay, well, I'm paying this, in some cases, over $500 annual fee. Well, if you add that up over a 30-year career, and then what I could have earned in the markets at 8% interest rate, it actually adds up to a substantial amount of money.
Okay, but you can only fill out that initial application and pay that initial fee if you're actually qualified, or if you meet all the qualifications for the different professions. And so this gets into another part of the cost, and probably the more substantial part, and that's the cost of training or education that would be necessary to get the job. So talk about some, just in general, what are some of the types of training or types of education that people have to get some of these different jobs?
So sometimes it's just specialized training. So like a cosmetologist has to go to beauty school and spend a year or two taking courses specifically in that field. Some occupations require an associate's degree. Some require a full 4-year college education. Some, like doctors and lawyers, obviously even require graduate education. Now, when calculating these costs, it's really important we stress in the study that some of these costs are still going to exist even without occupational licensing. But a lot of these costs, especially when you talk about low-income professions, are sometimes unnecessary, especially when you look at the requirements for licensing in other states. But there's also, we didn't include in this calculation, but also several occupations have experience requirements. You have to practice in that field for a year or two, be an understudy. We didn't include those in the cost, so if anything, our estimates are a little bit conservative.
In some of these cases, like these formal education or formal training requirements apply to people who maybe are already quite knowledgeable about the field. I mean, in fields like hair braiding, for instance. I mean, people who already know how to do it, they end up being subject and have to go get training, even though, in effect, they already know what they're doing, right?
Yeah, there's a lot of other ways besides just formal training that you can acquire these skills, such as experience. You know, my wife is a licensed physical therapist here in Alabama, and she knows of PTAs, physical therapy assistants, that have only, you know, had 2 years of formal training, but she thinks are better than someone that has a doctorate degree in physical therapy in terms of treating patients, just because they've been working for 10, 15, 20 years. But because of these licensing laws, the person with the doctorate degree, you know, can get licensed, and the PTA has to work underneath them, and unfortunately can't work directly with the patients.
Okay, so when we get into talk about the cost of education, there's actually two main costs of education, and this is an important thing because it actually illustrates something that we all the time talk about in our economics classes, is something known as this opportunity cost. So tell us about these. What are the two main costs of getting formal education or formal training for some of these jobs?
Yeah, so the initial cost is the explicit cost. So I think the best way to do this is actually an example that I give my college students.
Okay.
So I talk about, okay, how much does it cost to get a degree at Troy University? Well, that's the explicit fee listed that Troy University gives you and says, okay, this is how much you have to pay per semester. You have to pay the cost of the books and any other supplies you use to get educated. And that's oftentimes what they come up with. But I challenge my students to think, is there any additional costs you're not considering? Besides those initial explicit costs. And what they don't consider is the even bigger cost of opportunity cost. And that they could go out and get a job earning $20,000, $25,000 without a college degree if they were not going to college. So you have to add that. You have the tuition cost, but you also have the cost of what you could have done with your time if you had not spent that time in college. That's the total cost of getting a college education. So when it comes to occupational licensing, you have to look at the explicit cost charged that they're paying that we've already discussed, but also the opportunity cost. If they're going to school 4 years to get a license, well, that's a lot of opportunity costs that we have to add up.
And then in the fields where you do need graduate or professional training, that's just adding as well. And I guess the issue would be is the more education you already have, the higher the salary you could be earning if you weren't, say, in graduate school, right?
Yeah, in fact, that's what made these calculations a little bit more complex, is for every year of education they got. So if it was just 1 year of college, 2 years of college, 3 years, 4 years, 1 year of graduate school, 2 years of graduate school, we had to increase that opportunity cost. So we carefully did that to ensure that we reflected the fact that as they got more educated, their opportunity costs increased over time as they earned these degrees necessary for licensure.
And if I recall, when you're in your calculations here, it ends up that the opportunity costs are actually a larger share of these education and training costs than the actual tuition cost itself, right?
Yeah, by far.
And you also were relatively conservative in some of your estimates here, especially in things like cosmetology schools. You were picking out like the least expensive of the cosmetology school options, right?
To the extent possible, we located the cheapest possible option. it's hard as someone who's not a practitioner in that industry to know of every possible option to get educated in the field, but we did our best, researching online and otherwise calling the boards to try to find the cheapest possible education cost to be ordered in order to get that degree. For instance, there's a huge variance in the cost of college education across Alabama. We didn't choose the highest price university in Alabama for our calculation.
Okay, you chose, I believe, public universities, and what the in-state tuition would be at a public university. You could certainly spend more than that, but that in many cases these are the minimum costs it would take to get that. So what are some of the totals here?
Yeah, so looking at, there's a wide range. A lot of occupations over 60 had no initial educational cost, but you did see some substantial costs for a lot of occupations. You had around 12 occupations that had $1 to $999 worth of initial educational cost. Over 30, around 35 occupations had between $10,000 and $99,000. Those are usually the ones requiring a 4-year degree. Then once we get over 100,000, we're usually into the ones that require a graduate degree in order to practice in that occupation. Now, overall, it cost $45 billion for all of the currently licensed practitioners in Alabama to get the initial education cost.
Yeah, and I know people, when they graduate from medical school, and not just medical school, because now you have to go on and get specialized training in medicine. I mean, they'll graduate with $400,000 or more of just a student debt, right? So it's and that's all part of this cost, right?
Yes, that's all included in there. Now, what we did include is, like, if you're required to do a year of clinical work at a reduced price, that wasn't included in there. So it is conservative on certain margins.
And even still, that's not the end of it, right? You get you get your law degree and you pass the bar exam, you can practice law, but then there's also something that you wouldn't have known before about CLE or continuing education in lots of different fields, right?
Yeah, so many of these licensed occupations not only require that you meet a certain standard of education prior to getting admittance to that field, but also require you to have ongoing educational requirements fulfilled, usually annually, but we saw some that were also biannually. So you had to go out and find courses online or go to conferences in order to meet these requirements to demonstrate that you're continuing your education.
In one sense, you can understand that the spirit or the intent behind this. There could be new developments going on. Obviously, if you're a doctor or a dentist, there could be new advances that you should be aware of. But then there's also the issue of, if you're working in the field, I mean, aren't you probably already aware? I mean, you're working in a field, aren't you probably aware of the new things that are coming along anyway?
Yeah, and I think it doesn't account for the fact that there's other ways that people learn. So I think, especially talking to my wife, working in the medical field, it's clear that one of the best ways that they learn is actually through the clinicals. They bring in a 4th year, 5th year doctorate student that's been through all the coursework and now is just getting relevant experience. And they're able to bring up new technologies, new theories, new evidence that the practitioner may not have heard of. And I think this is actually one of the primary ways that physicians and other people in the medical field stay aware of new updates. Also, there's a strong incentive. If you're a practicing lawyer and you're in real estate, well, you have a strong incentive to be informed of new updates dealing with what you're working in, right?
Because if you're not, you're going to be doing badly in cases, and nobody's going to want to hire you.
Yeah, so I think there's already incentive for people to stay informed of what they're practicing in, even if they didn't have these mandated requirements.
So these are much more modest compared to the upfront cost, right? But it's still not trivial in some of these cases.
Yeah, so overall, if I remember correctly, it was $223 million that these came to. So substantially less than $45 billion for the initial cost, but still a substantial cost that these practitioners have to pay every year.
So if we tally this up here, and It's just sort of summarizing what we have here. And I guess the important thing to note here is that all of these are billions except for the one in the lower left. That's got to be there. That's a billion, right? In billions.
Yep, these are all millions except for the 65 billion. And in the study, we actually break this down for how much it is per licensed worker. It ends up representing a substantial amount at the individual level out of their pocketbook. But then when you look at these aggregate numbers, what was kind of shocking to me is how much it's taken out of the Alabama economy.
And these costs are all going to end up having to be reflected in terms of the prices of the different services. If you're a lawyer, you eventually have to make up enough money to pay off your law school debt if you have that, or in each of these fields, right?
Yeah, there's as we say in economics, there's no such thing as a free lunch. Someone is paying for these costs, and oftentimes these costs are passed on to consumers in the form of higher prices, which when we talk about occupational licensing before, sometimes when the cost of hiring a licensed professional goes so high, poorer individuals are unable to be able to pay for that licensed practitioner, and thus either have to go without the service or resort to black market provision, which is more dangerous than would be, if you could hire someone with just a little bit of experience.
Or do stuff themselves, which
yeah.
could also
Very
be quite
dangerous.
Yes, very much so. So, okay, now, one of the things is that I was struck with when I first started learning about continuing legal education is some of the things that get counted toward legal education. And my favorite was like a golf tournament that somehow they got you get CLE credit for doing that. And so it seems like some of the forms of continuing education could be a bit of a scam, where essentially you have to they're extracting some money from practitioners. But actually, and this is a point of a fairly important one in economics, they're actually be good for society if they really were just requiring people, say, to write checks as opposed to go through meaningless training. Could you explain this for us?
Yeah, so this is a point that especially Gordon Tullock, public choice economist, has been made for a long time, and that if we're going to have some type of distribution where a group is going to get a special privilege that's going to cost everyone else, well, rather than going through the false pretenses of saying we're actually doing this licensing thing is going to improve, make consumers better off, it'd be more efficient if we just said, okay, these people want to tax us and we're all going to pay a little bit extra. So it'd be a lot more efficient if we could just just admit that what's going on behind the scenes and do away with all the false pretenses that they're actually getting educated in these continuing education courses, and instead just write out a flat check. The problem with this is that if people are actually aware of what's going on, then the special interest group isn't likely to get this direct tax.
Right.
So they need to have this ruse almost in order to get it passed in legislation that then they can get this special tax that ends up going to them.
But if you take like a doctor or a lawyer or a plumber and say, like, okay, you have to take one afternoon and there's 3 hours to go to some training that's not actually going to teach them anything they don't already know, or anything that's possibly relevant, and you have an opportunity cost with that. And besides just the amount that they have to pay for the training, the opportunity cost, it gets quite substantial in that case.
Yes, and just like most of our other estimates, we were very conservative with continuing education requirements, and mainly we did online ones that were fairly cheap, but they can get very extravagant. You can go CEUs and CELs out in like a conference at Hawaii or something like that. So these could be substantially more than the cost that we stated.
Okay, so you mentioned this earlier, but I want to come back to this point. Now, clearly, even if we didn't have occupational licensing as a government-regulated system of access to physicians or dentists, people wouldn't want to go to a doctor whose only knowledge of operations was from the children's game operation, right? You clearly wouldn't want to go to a lawyer who doesn't know anything about the law. So clearly, even if we didn't have any licensing for all of these fields, there would be education requirements that would be involved. So talk a little bit about, like, if we didn't have licensing, what would be the ways in which we'd have some of these education requirements put on, and then we want to get into what are some of the differences and why that might matter.
Yeah, so largely when it comes to the higher end professions, lawyers, doctors, and the such, I think the educational costs would largely still be there. You're going to walk into your doctor's office, and even without occupational licensing, you'd probably say, okay, look on the wall, where's their degree from? If is it a university you recognize and that's reputable? If not, you may question whether you want to receive medical treatment from that physician. But I think importantly what it allows for poorer individuals who may not be able to afford someone educated at Harvard Medical School to maybe has a year or two of practical experience or has studied on their own. They may be able to provide lower end care for if you have a sore throat or something minor that they could look at real quick, such as like a nurse practitioner or something. They could say, okay, well, you clearly have a sore throat. So they could get someone that doesn't have the highest terminal degree, but does have some relevant medical experience, at least to diagnose lesser things that would free up room in our overcrowded hospitals and patient rooms, and allow lower income individuals have access to healthcare, which they may not have under the current licensing regime.
And insurance companies would be playing a big role in making a lot of these very specific decisions about like exactly how much training is going to be required, right?
Yeah, insurance companies would play a large role, I think, in two different capacities. First, in terms of when you're a patient and you go to your insurance company, they want you to receive efficient health care. They don't want you to receive the cheapest health care, because then you're going to get sick again and you may have a recurring health problem that gets more expensive. So they want to send you to a qualified practitioner to address the problem and thus minimize the overall cost. So in that capacity they will. There's also a second way they'll do this, and this is through malpractice insurance that many medical care providers are going to go out and purchase. And in order to get it, these malpractice insurance agencies are going to look at the qualifications that these doctors or other medical care providers have, just to ensure that they're not a high-risk medical provider. If someone isn't qualified to be delivering those services, it's unlikely that a malpractice insurance agency is going to extend them coverage, at least at any rate that that is affordable for a healthcare practitioner.
So then the issue would be, in the absence of licensing, you'd have to be looking to see, well, who's insured, because an insurance company is going to insure them if they absolutely know nothing, unless they have a pretty high level of knowledge, right?
Yeah, so as a patient, you could look at two things: the medical degree on the wall, and then two, are you insured, adequately insured? And those two are going to send a high quality signal, I'd say arguably even better signal than occupational licensing would.
Economists, when they talk about occupational licensing, worry that licensing can form a barrier to entry. And so explain a little bit about what we mean by a barrier to entry, and then how it is that any kind of excessive education or training costs can form a barrier to entry.
Yeah, so this is actually what motivated my research into occupational licensing, both academic and policy, in the first place, in that we are putting very costly requirements into entering a profession that poorer individuals in society are unlikely able to meet. And this is particularly a concern when it comes to low-income professions that are licensed, such as cosmetologists, barbers, things like that aren't widely licensed or aren't, it doesn't need to be licensed that extensively, or I would argue doesn't need to be licensed at all, represents a barrier to entry. So it prevents economic mobility, prevents a form of entrepreneurship and ability to live the American dream, own your own business, open up a barber shop. That's not available to these individuals, because now you have to go to barber school, which is a substantial cost for someone that may have a kid or two, right? But if they know how to cut hair, they could easily open up a barber shop and start living the American dream.
And particularly, I mean, if it's an expensive form of training, you have to borrow, it becomes that much harder if you already from a low-income family, right?
Absolutely.
If you don't already have those means. Well, Thanks very much for coming out and talking about these very important estimates of this cost here of licensing in Alabama. And thank you for joining us. Join us again next time for another EconVersations.